I would now like to comment on the reference ranges for vitamin D metabolites to help physicians in their clinical judgment of whether to use vitamin D receptor agonists for the treatment of IACC conditions. Starting at the upper right of the slide, you see a gel cap containing a very small amount of calcitriol, a quarter microgram, 0.25 micrograms. This is a therapeutic daily dose, and I'll explain the context of that statement shortly. Again, calcitriol is 125 dihydroxy vitamin D3, abbreviated here as 125 vitamin D3. It can be also abbreviated as 125D3 or simply 125D. All of those abbreviations can be found in the scientific and medical literatures. Calcitriol is a key immune hormone. Arguably, it is the most powerful immune hormone in the body. Its reference range, according to Mayo, is 20 to 80 picograms per mil. It has a molecular weight of 417. In the mid part of this reference range, say 40 picograms per mil, that corresponds to a concentration of 100 picomolar, or 0.1 nanomolar. This is in the range of concentrations similar to sex hormones, which are also at very low concentrations in the body, but similar to sex hormones, calcitriol exerts its powerful actions through receptors which are present on virtually every cell type in the body. Now, 20 to 80 picograms per mil is the, quote, normal reference range. But what about pregnant women? Turns out that during pregnancy, calcitriol levels can double or even triple. So the serum calcitriol levels are 2 to 3-fold higher than in the general population. So the reference range for pregnancy, and this is the third trimester, calcitriol during pregnancy, third trimester, 60 to 120 picograms per mil. So when we discuss the toxicity of calcitriol, it's important to recognize that even at these higher levels, this is not producing toxic actions in a pregnant woman. And I'll explain in a moment why. So if you're considering about the impacts of calcitriol on organs, such as kidneys, immune cells, or the cornea, realize that all of these systems produce calcitriol locally. For instance, the kidneys produce about 85% of the circulating calcitriol in the body. However, immune cells can also generate calcitriol locally, and they do so in granulomas, which are aggregates of immune cells that are fighting an infection. The cornea also produces calcitriol locally. Also lacrimal glands, the tear glands. And so the narratives surrounding calcitriol are complicated by anatomy and transport physiology. So adding a mere quarter microgram orally, not all of this will be absorbed in the gut, is enough to boost endocrine, exocrine functions and to help promote tissue regeneration. I'd like to illustrate that by talking about the reference ranges necessary to promote tissue regeneration. So what is the reference range, RR, of 125 vitamin D, which is needed to promote tissue regeneration in IACC conditions, like long COVID? I'm using the abbreviation 125 vitamin D to include both calcitriol and paracalcitol. Again, paracalcitol is the synthetic analog of calcitriol, and we have been arguing on this channel that if you're going to use a vitamin D receptor agonist long term that's going to maximally stimulate vitamin D receptors, it's better to use paracalcitol because it is less calcemic than calcitriol, meaning it doesn't elevate calcium levels in the serum as much. And this gets us back to calcitriol during pregnancy. With these 2 to 3-fold higher levels of calcitriol, one would expect elevated calcium levels in the woman's serum. It's true that calcitriol mobilizes calcium from a woman's bones. It also stimulates calcium uptake from her intestine. And yet, her calcium levels do not rise to toxic levels where her blood vessels become calcified. Why is that? It comes down to sources and sinks. The sources for calcium are the bones and uptake of calcium from the diet. However, there is a sink in a pregnant woman, the baby, which is forming bones, particularly during the third trimester. So this elevation of calcitriol is important to mobilize calcium from these sources, the woman's bones, as well as increased calcium uptake from the gut, and those are transferred to a sink, the baby's forming bones. But during this time, the woman, the expectant mother, gains immune benefits and tissue healing benefits from the elevated levels of calcitriol. And one could extrapolate that by activating vitamin D receptors prior to birthing, the stimulation of antioxidant capacity within the mother's cells help prevent ischemic reperfusion injuries that could occur during the birthing process. Now, how the elevation of calcitriol fits into the endocrine system and the exocrine system, these impacts are being reported in PubMed, but they need to be integrated into the thinking of practicing physicians, because in the case of IACC conditions such as long COVID, there is a plethora of pathogenesis occurring through the body. And if one is looking for a hormone replacement therapy that can reduce ischemic reperfusion injuries, increase the ability to withstand oxidative stress, and to promote tissue regeneration, vitamin D receptors fit this need. Now, some historical evidence to justify these assertions. This is a paper from 1992. Treatment of postmenopausal osteoporosis with calcitriol or calcium. Continuous treatment of postmenopausal osteoporosis with calcitriol for 3 years is safe and significantly reduces the rate of new vertebral fractures in women with this disorder. This is 1992. So 30 years later, this is a paper from 2025. Clinical outcomes and safety of combined calcitriol and bisphosphonates in treating postmenopausal osteoporosis, a retrospective cohort study. Conclusion: the combination of calcitriol and bisphosphonates demonstrates superior clinical efficacy and safety in treating postmenopausal osteoporosis, effectively reducing pain and disability, enhancing bone metabolism and immune function, and improving bone mineral density and daily living ability. So once again, the therapeutic dose of calcitriol for a number of these studies is about 0.25 micrograms per day. In the case of paracalcitol, the daily therapeutic dose, a low-dose formulation, is about 1 microgram per day. And that's because paracalcitol binds to the vitamin D receptor less avidly than calcitriol. So what is the reference range of 125 vitamin D, which is needed to promote tissue regeneration in IACC conditions like long COVID? This will require clinical studies, whether you're using calcitriol or paracalcitol as the therapeutic agent.